Hello everyone, this is Saika Zaman. Today I am going to present a slide based on information retrieval in healthcare system. So here are the list of the contents which I am going to cover in today's presentations. So here's the introduction slide. Healthcare generates a massive diverse data every day. Through information retrieval, clinicians and researchers can quickly find meaningful insights from this data. Recent advances in NLP and LLMs have made medical search smarter and more context-aware, so improving how knowledge is discovered and applied in healthcare systems. So here are the motivation of choosing my interest of information retrieval in healthcare systems. So healthcare data can come from many sources, for example, electronic health records, medical images, clinical notes, and genomic data. So these data sets are massive and often unstructured, making it difficult to extract useful information. In such kinds of cases, information retrieval systems help to overcome these issues by organizing and retrieving relevant data efficiently. So, however, there are some challenges such as data heterogeneity, free text complexity, and privacy regulations, which is the remain key barriers to effective healthcare data management systems. So here are the pipeline how information retrieval systems actually work. So by starting the describing data acquisition, where healthcare data is collected from sources like clinical notes and images, then it is moved to the indexing process, where the data is pre-processed to make searches faster. In query processing states, the system interprets the user's questions, often using techniques like expansions or embeddings to understand intent. The next step is the ranking, where methods like TF-IDF, BM25, or dense embedding systems decide which results are most relevant. Then finally, the evaluation part, where the performance is measured with metrics such as precision and recall to ensure accuracy and reliability. So there are some techniques of the information retrieval. So the Boolean retrieval, it matches exact keywords or logical combinations, for example, and or not. Where the vector space model measures the similarity between queries and documents, and the term frequency inverse document frequencies, which is known as TF-IDF, which is a very popular method in information retrieval system. It actually generates the score of words by frequencies and uniqueness across the whole documents, but there are some limitations in the information retrieval technique, as they don't understand the major limits is that the contextual understanding of meaning. They don't understand the context or the mis-synonyms and are sensitive to variations in phrasing system. For example, if in like documents we see the heart attack, and another pages, if the heart attack, if the synonym of heart attack is mentioned as myocardial infarction, at that time it cannot detect that the heart attack is the same meaning of the myocardial infarction. In such kinds of states, information retrieval techniques fails. So to overcome these kinds of situations, here information retrieval interact with the natural language processing system. So NLP helps information retrieval system to understand medical language rather than just matching keywords. So here are some steps like ontologies like UMLS or SNOMED CT standardized term across the dataset. So and NER identifies diseases, drugs, and symptoms in the text, and the query expansion links related terms. So a query like heart attack also retrieve myocardial infarction. This makes the search more accurate and ensure fewer misresults. For example, in my previous slide, I mentioned that if two pages documents here, and heart attack is mentioned in the first page, and in the another page, if myocardial infarction is it is mentioned, then the regular information retrieval system cannot detect the myocardial infarction as same as the heart attack meaning. So in this case, if information retrieval were integrated with the natural language processing, then these kinds of misresult can be reduced. So information retrieval also helps doctors make faster and more accurate clinical decisions. It may find similar patient cases, retrieve medical literature, and check drug interactions to guide safe treatments. These systems support evidence-based care, save time for clinicians, and improve consistency in diagnosis and treatment planning. So in this slide, I will discuss how image retrieval helps to make diagnostics more intelligent and data-driven. Instead of relying on text-based searches, CBIR system compare image content directly as the healthcare as the patient diagnostic report not only word-based, it can also based on the X-ray, CT scan, so some or MRI or some kinds of images also involved in a patient database system, right? So in this case, tools like CNNs and CLIP, this system can find a scan showing patterns similar to a patient's image. This saves times and supports radiologists in identifying rare or complex condition by referencing similar confirmed cases. So IR plays a vital role in global health studies and research during the COVID-19 pandemic. Information retrieval systems like LeetCovid and PubMed Central helped researchers quickly find relevant studies and datasets and the pattern of the virus too. With large language models, it retrieved the articles can now be summarized automatically, saving time and improving comprehension. For example, if you give if you give a report to the particular LLM, then it will generate a summary of that report. So in this way, you can save your time and improve your knowledge and the research. So and also how they and also there are also some benefits, like it can accelerate public health decision making, reduce information overload for researchers, and enable real-time access to global findings too. So but there are some privacy and security challenges when we involve information retrieval with the modern LLMs. So healthcare data is highly sensitive and requiring strict protection to ensure patient privacy and compliance with regulations like HIPAA To address this, de-identification technique remove personal information before data sharing, while federated information retrieval systems enable hospitals to collaborate without exposing raw records. Advanced methods such as differential privacy and homographic encryption further secure data during processing and retrieval, which ensure that valuable insights can be accessed safely without compromising confidentiality. In this way, information retrieval can be done very securely, while the patient information can be kept confidential. So now the hype trend like large language model like GPT-4 and BioGPT make searches smarter by understanding meaning, not just keywords. They enable conversational retrieval, allowing clinicians to ask natural questions and get relevant result. Using a knowledge graph, this system connect diseases, drugs, and symptoms to provide deeper medical insights and improve decision making too. So here is an example how like information retrieval can be applied to detect lung cancer. So here at first a patient's CT scan image and clinical data are processed through an information retrieval engine using models like Medclip and radiology birth. This system retrieves similar annotated scans and related medical information to help generating diagnostic report. This approach assists radiologists in detecting lung cancer faster and ensures more consistent and evidence-based reporting. So when we give the CT scan report and any kind of written documents, then the IR engine which is Medclip and radiology BERT will combine those image and text based report and generate a report which will be convenient for the radiologist. So here the conclusion of my today's presentation. So information retrieval plays a vital role in healthcare by enabling quick and meaningful access to large complex dataset. It helps clinicians, researchers, and policymakers make informed data-driven decisions, leading to better diagnostics, efficient workflows, and improved patient outcomes. By emphasizing that information retrieval continues to involved with AI and NLP advancements shaping the future of intelligent healthcare systems. So here are some future works. So future information retrieval systems should be focused on being explainable, real-time, and multimodal to improve medical transparency and insight. They must also use privacy-preserving methods to ensure secure handling of sensitive healthcare data. So that's all for today's presentation, and thank you all for your time.